Hey guys, Szenan-Paul here. In this video, I'm going to show you scoliosis treatment that we choose huatuojiaji point to treat it. This is a slight lumbar scoliosis. It's a simple one. Let's check it out.
Start again. Yeah, start off because it's between those two fingers. Yeah, and now down to here is on the side, and this is on the bone. Soft, soft. Okay. So it's all in here, toward to that way, but okay. Now you can stop the video now. Right, go to by her. Wow. See that, huh? Okay. So you may have, because the patient don't know which one's more sensitive, so you can run 1 or 2 times, and the third time you ask them to go. So tipping out. So what's huatuojiaji? This is spine, and about 1 finger from here to here. This is huatuojiaji, 0.5. So huatuojiaji, you get the needle in, you go straight in. This is 40 mm on the bone now. Here we don't do that because there's no bone there. And then here, okay. You do 1, 2, 3. 1, 2, 3. And going down that way. 1, 2, 3. That's it. Okay. Tell See that? Yeah. There's a point here, but no point here. So over here, needle in. 1, 2, 3. And we go up. 1, 2, 3. Down. 1, 2, 3. That's it. Okay. Now we check on the other side as well. Over that side as well. Yeah, over.
You check where it's painful?
Yeah. Is there anything on the spot? A little bit in here. Remember, this is the in leg side. In leg side, you want to stimulate less. Yang side, more. So inside, straight, 1, out, up, 1, up, bottom, 1, that's it. The yang side. Start from here, right? Good, good. All good now?
All good, really.
Yeah, you try this out. An example.
Well, last case was just a slight lumbar scoliosis, so it's very simple. You just need to apply the huatuojiaji point. That's it. But the next case is gonna look at it. That it's scar tissue issues. So we need to release the scar tissues, and there is a yin yang leg imbalance. We need to treat the leg, and then we need to treat the lumbar. So there is a severe sciatica plus scoliosis. So it's a bit of different treatment, but check it out as well.
Okay, I can see it. Now you can walk back. Awesome. That's it. There's no pain in the back and leg at all. You can see the structure imbalance in this case.
Well, if you want to learn this technique, click the link around this video or contact us and come and join our next workshop.